Thank you, Dr. SNEHA KHARALKAR. Good evening, good afternoon, and good morning. This is the 1596th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SNEHA KHARALKAR. Let us begin the session with 1 minute silent prayer.
Good evening, sir.
Thank you all. Please wait. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, homeopathy students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and we have an international session in English that begins from 8:30 to 9:30, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day at the YouTube by name IFPH Homeopathy. Please subscribe as well as share with your friends. There is no money for watching the videos. That's the most important aspect as far as homeopathy IFPH is concerned. And the purpose of this forum is to promote homeopathy among public, so that take homeopathy to each and every household in all over the world. And not only that, to connect doctors internationally from around the world. Already, doctors and eminent personalities from 65 countries are present at various papers in this forum. And all these papers were really brilliant. And let me come to today's session. As you all know that today our guest is Dr. SNEHA Kharalkar, and she has completed her MD in homeopathy and then PhD. She is working as a PhD scholar in public health, and she has another degree in Master of Public Health, and she is working as an associate professor in the Department of Community Medicine and Merchant Homeopathic Medical College and Hospital, Dasna, Gujarat. She has more than 6 years of experience, and she has presented the conferences as guest speaker on third national conference on recent trend in engineering management, pharmacy, architecture, and science at Nobel University, and in 2021, and All India PG Homeopathic Seminar, Paul University, Vadodara in 2024, and the International Conference on Research and Innovation in Multidisciplinary Domains, Nobel University, Jagannath in 2024. And a very, very important subject is to be discussed in this evening with you, and that is a holistic health, exploring the psychosocial model through homeopathy case studies. That's a very, very important subject. These kind of studies are really needed because we have to prove the world that homeopathy is one of the purest science, and it is the most brilliant science in the world. And there is nothing called pseudoscience, but it is the real science. So we proudly welcome the guest of the day, Dr. SNEHA KHARALKAR. Welcome.
Thank you. Good evening, sir. Am I audible, sir?
Yes, everything is fine. You can share the screen also, and you can go ahead with the
Oh,
presentation for the next 45 minutes, and we can have some time for discussion. Okay.
okay, sir. So I'm starting my session.
Okay. Yes. This
Okay,
visit.
is the
Yes, everything is
yes,
fine.
thank you.
Everything is fine.
Okay. Thank you so much, sir. Uh, so good evening, everyone. I'm Dr. SNEHA Kharalkar. I'm working as an associate professor in the Department of Community Medicine and also Community Outreach Program in charge at Merchant Homeopathic Medical College, Mehsana, Gujarat. So today we will explore two cases under the title Holistic Healing, Exploring the Biopsychosocial Model through Homeopathic Case Studies. Here we can address the physical, mental, and social dimensions of health for the comprehensive healing. So let's begin with the case number 1. A 47-year-old female patient, Mrs. KLM from Gujarat, she approached us seeking relief from persistent skin rashes. Her condition started 2 years ago and has been exacerbated by emotional stress related with her personal life. Her case highlights the complex interplay between the emotional health and physical symptoms. Here is the history of presenting illness. Mrs. KLM's condition began after discovering the uh, extramarital affair of her husband before 3 years. Her timid nature prevented confrontation, which lead to suppressed emotion that manifest into the skin rashes. These rashes highlight the significant role of emotional trauma, especially in with the physical elements. These are the chief complaints of patient. The location was forearm, upper extremities. All the complaints were since 2 years. There is itching, burning sensation, dryness, oozing of fresh blood, crawling sensation over the rashes. The onset of complaints was gradual, progressive in nature, and the intensity was moderate to severe. All the complaints aggravate after using soap and detergent while doing uh, daily household chores. Burning sensation aggravates after itching, and the accompaniments were irritability and occasionally disturbed sleep because of intense itching. Here is the associate complaints. The location was mind, where she was feeling irritability, anger spells, persistent thoughts about future, mood swings, and most of the time she wants to weep, especially when she is alone. All the complaints were started from the disappointment by her husband's extramarital affair, aggravation by contradiction, and in accompaniments, she occasionally has a disturbed sleep. If we look her physical general, so she was a lean, thin lady with fair complexion. Perspiration was moderate, especially on upper lips and scalp. She has a typical craving for spicy food and namkeen items. Thermally, she is ambithermal patient. She has a fear of strangers and has motion aggravation. She can sleep comfortably for 6 to 7 hours, but occasionally get disturbed by itching. She has a typical dream of dead relatives and walking in a strange forest. She has a past history of anemia during pregnancy, which was treated very well with supplementations. If we look after her family history, her father has diabetes and hypertension since 17 years. Her mother is also diabetic patient since 9 years. Her brothers have no any significant health issues. Both the general examination and systemic examinations are normal. Now let's evaluate the life events of patient. The life space evaluation is very important to understand the patient as a person. So here is the patient's life space. She is the eldest of all her siblings. Her father was strict and dominating. Her mother was mild in nature. Because of her father's strict and dominating nature, she developed a timid and submissive behavior since childhood. Academically, she was very good, but her father didn't allow her to pursue higher study. So she was So she felt disappointed but did not stand for her aspirations. She was then involved in raising her siblings with her mother. She felt frustrated, but due to her timid nature, she didn't confront her father. Such environment fostered her nature as a reserved, timid, conscientious, and sensitive to authority figure. She had an arranged marriage at the age of 21. Her husband is alcoholic and abusive in nature, but she didn't react due to her timid and submissive behavior. But such dynamics always frustrate her and annoys her. Then what is the triggering event for her complaints? 3 years ago, in 2016, this case is from 2019. Okay, so now in 2016, she discovered that her husband has an extramarital affair. This event has shocked her, and later, patient felt betrayed and disappointed. She suppressed her anger because she felt that if she confront her husband, he may abandon her. N- Now, she only have two children as a source of emotional support, but often she feels lonely if they ignore her. Further in her life space, she had a very limited social circle. She only shared her problems with her best friend. Despite of her reserved nature, she by other person. She is very conscientious in nature and caring towards her family, often at the cost of her own emotional well-being. But due to the lack of reciprocity from the another person, she always feel disappointed. The diagnosis of this disease was irritant contact dermatitis. I have made this diagnosis with the help of International Classification of Disease criteria, which is EK02. Uh, for after evaluating the patient's life history, I can conclude patient as a conscientious, reserved, timid, anxious, and irritable person. Here is the totality of symptom. I have used Tintin approach because this case has a plenty of uh, characteristic mental symptoms. So this is the totality of symptom. Here is the repertorization, where you can observe that the close coming remedy was natramur, pulsatilla, lycopodium, staphysagrine, and ecodite. Here, the remedy I have made remedy differentiation between three close coming remedies, that is natramur, pulsatilla, and lycopodium. Here, emotional expression, core fear, mood, physical keynote, and response to the comfort are the main aspect of the remedy differentiation. So the final selection of remedy was natramur. The potency which I have selected was 1M because uh, I have evaluated patient with a moderate to high susceptibility. So here is the follow-up criteria, that is itching, burning, bleeding, dryness, crawling sensation, new eruption, and discoloration of the existing rashes. Here is the follow-up. Here is the follow-up. On 26th of June 2019, patient came for the treatment. At that time, the case definition, detailed case taking was done. That time, natramur, one single dose has given to patient, followed by Saclec. On 3rd of July 2019, her itching complaints were better by 30%, and burning sensation was also better by 50% with the single dose of natramur. But it was a slight, as it was a slight improvement, I have given her the same medication, natramur, single dose only. On second follow-up, that is on 10th of July 2019, all the complaints were improved by 50 to 60%. At that time, I have given her only cyclic, and I wanted to July 2019, patient came with all the symptom aggravated. Old symptom reappeared once again, so I repeated the medicine, that is natramur 1 mHs, and followed by the cyclic for next 6 days. And this medication given her for 2 weeks, so I have given her a natramur single dose followed by that time after 15 days, that is on she came after the gap of 1 month that time. So on the last follow, on the 4th of September 2019, all her complaints were ameliorated by 90%. So she was better, overall betterment was 80 to 90%. That time also, I have given her natramur single dose followed by cycling. After that, patient did not appear for further follow. Her sister was my old patient, so she reported me that her skin complaints got resolved completely even after following the same daily routine. Though the patient was improving physically, but her complaints, but her feeling state of betrayal and disappointment resurfaces each time whenever she sees her husband. When I ask her to try to cope up with the given situations, she always reply me that I don't have any other option rather than other than I have to remain in this relationship. As a physician, I could see it as a maintaining cause to this particular case. Here, uh, there are some pictures which I have shown in this presentation. First picture is on the day of case definition, that is 26 June 2019. Here you can able to see the rashes, the dermatitis patch on the forearm of the patient. On the first follow-up, that is on 3rd of July 2019, you can observe the scaling is reduced, discoloration is also reduced, and patient was telling that itching is also reduced by 50%. On the second follow-up, patient's itching and burning sensation is increased, but the scaling and discoloration is reduced. On the third follow-up, you can able to see the scaling and discoloration is reduced significantly. And also itching was also better by 80 to 90%. This is the last picture, last follow-up on the fourth follow, where you can see that her skin is looking very normal, almost healthy. After this follow-up, patient discontinued the treatment. Her sister, as I already told, that her sister was also my patient. She reported that patient is able to do her household chores, able to use detergent without any discomfort nowadays. So, what is my learning from this case? The first learning is the impact of suppressed emotion. So, suppressed anger and unresolved disappointment act as a significant maintaining cause, perpetuating her mental and physical ailment. Even after giving the well indicated, well suited remedy, the unresolved psychological factor may hinder the complete recovery. My second learning was integrating the emotional support. In addition to the homeopathic treatment, counseling or emotional support is very important to address her unresolved emotion, but the impact is so deep that the patient is not coping from it and it acts as a maintaining cause. My third learning is holistic healing. Although the homeopathic remedy ameliorates her skin complaints, but the true healing requires addressing the patient's emotional wound. Without resolving those emotional wounds, the patient may remain emotionally unwell that risk the reoccurrence or incomplete recovery. The fourth learning was importance of the biopsychosocial model in homeopathy, which is the main core aspect of this presentation. Understanding the case using the biopsychosocial model emphasizes that the patient condition is not purely physical, but it is linked with her mind. So, through the biopsychosocial model, we could understand the case, and it also indicates the limitation of homeopathy alone in psychosomatic case management. Though her skin became healthy, her unresolved emotional conflict, including disappointment and insecurity, remained maintaining causes. Her skin complaints came after the mental symptom, that is, the feeling of cheated, betrayal, suppressed anger. So, after giving the well suited homeopathic remedy, symptom goes in a reverse order but gets stuck at the mental plane as patient is not able to cope up with the given situation. Here, you can able to see the biopsychosocial model of the given case. This model gives the understanding of a patient as a whole rather than focusing only on isolated symptom or disease. It provides the comprehensive framework for analyzing and addressing the complex interplay of biological, psychological, and social factors influencing the patient's overall health. Now, moving ahead, uh, we are discussing this second case. Our second case is Mrs. SSP, a 57 years old homemaker, which has a presenting complaint of alopecia totalis. Her progressive hair loss coincided with a significant emotional distress related to her elder daughter's love marriage. So let us explore this case. This is the presenting illness of the case 2, that is Mrs. SSP. She has hair loss started with small patches, progressing to complete alopecia, including loss of hairs from both eyebrows and eyelashes too. This was preceded by the humiliation and societal judgment over her daughter's marriage decision. Her suppressed anger and resentment highlight the role of emotional triggers in her condition. Patient reported that she doesn't have any itching, any pain, or any history of trauma to scalp, and she doesn't have any known allergies also. If you see the chief complaint, she is feeling naked and exposed due to the visible hair loss. She feels humiliated due to her due to her daughter's marriage and her baldness too. Her hairs fall in bunches initially, and later it was a complete baldness. No itching, no burning, no pain at scalp. Element from was indignation. She has a feeling state aggravate by thinking about her daughter's marriage. All the complaints, all the mental state aggravates during the social gatherings and stressful conversations. She has a suppressed anger and sadness as well. The disease was gradually started and progressively it gets worsened. The intensity was moderate. The emotional history of patient is that she has been tremendous emotional stress. She felt humiliated by her condition. She started to avoid social gatherings and has a developed low self-esteem. She also burst into tears when alone and feels a sense of hopelessness regarding her daughter's love marriage and her bald appearance. Patient is a lean thin and having fair complexion. She has a moderate perspiration, especially on the scalp, but she doesn't have any complaint of dandruff or smell. She has a great craving for tobacco. Even on the day of case taking, also, she was chewing tobacco. When I asked her about her addiction to tobacco, she told me that she is chewing tobacco since 20 years and she never abstained it and no any history of withdrawal complaints. Thermally, the patient was chilly and she has a specific fear of height. In past history, she had a COVID-19 infection in February 2021 and recovered without hospitalization. Her father and mother both have died. Father was suffering with hypertension and mother was suffering with diabetes mellitus, but they both were died due to old age. And her brother, who is 52 years old, has diabetic mellitus and hypertension, and he is on allopathic medication. Both the general examinations and systemic examination were normal. All the reports of the patient was normal, especially thyroid uh, problems. I have ruled out all the things. Those were all the normals. If we see the patient's life space, patient grew up in a traditional family where obedience and respect for societal norm were encouraged, and expressions of emotion like anger and disappointment were discouraged. Patient studied up to 5th standard, and her father discontinued her schooling and put her into the household chores. She had an arranged marriage at the age of 22 years. Her relationship mostly focused on maintaining harmony in family and avoid conflict. He has 3 children. First, eldest daughter, age 32 years. Second, 28 years old son, and younger daughter is of 25 years old. She felt very pride in raising very obedient children. Now, this is the life space of patient. But what is the triggering event in this case? So, the triggering event came when her elder daughter did love marriage outside her caste, but in the same religion. At that time, patient felt very humiliated and dishonored by the behavior of her elder daughter. Because, as I already told you, that she is a very pride mother. She has a very good pride of her children. So she suppressed her anger at that time and forced her youngest daughter to quit her studies and kept her younger daughter in a strict supervision so that she will not dare to do the same which her elder daughter did. Currently, patient felt dishonored and she constantly thinks about her lost reputation in society. She avoids going in all the family functions, and she felt ashamed by the act of her eldest daughter. Diagnosis of this case is alopecia totalis by International Classification of Disease. The criteria code is ED70.21. From the life space investigation, I understand the patient as a reserved person, conscientious and dutiful, emotionally dependent patient, sensitive to reputation and resentment. Here is the totality of symptom. I used Kintian approach to formulate the totality due to the presence of characteristics mental symptom. Here is the repertorial totality, and you can observe that the most simillimum remedy is Staphysagrina. And second most important remedy, close coming remedy is carcinosin and ignatia. Here is the remedy differentiation of the 3 close coming remedies. All the remedies were differentiated on the aspect of core emotion, suppression, physical effects, behavior, reaction to conflict. So I decided to give her Staphysagrina 1 m because of the moderate to high susceptibility. And the follow-up criteria was observation on the basis of hair growth and hair root follicle. This is the follow-up sheet. On 29th of April 2023, the patient has came first in the OPD for the case taking. So the detailed case taking was done. At that time, I have given her the single dose of Staphysagrina followed by Cyclac. On 6th of May 2023, no any improvement has been seen on the patient's scalp. So I decided to uh, uh, carry out the same medication. So I prescribed her Staphylococcus aureus single dose once again and followed by cyclic. On I have given this remedy for 2 weeks. On 20th May 2023, no any improvements was showing. So I decided to stick with the remedy and given her Staphylococcus aureus single dose for 2 weeks. On 10th of June 2023, still there was no result, but I have to give her Staphylococcus aureus because it is a chronic condition. I know that it is a chronic condition and I have to be stick with the remedy, which is the well-suited remedy for that particular patient. On 24th of June, I have observed that her hair root follicles were open. Initially, when she came, her hair root follicles were closed. And on 24th of June, that is after 3 months, her hair root follicles were open. At that time also, I gave her Staphylococcus aureus single dose followed by Seclac. On 7th of July, the pores which were shrunken before the treatment were uh, were enlarging on in the further follow-ups. So I give her 3 weeks of medicine with the same medication, that is Staphylococcus followed by Cyclic. So on the sixth follow, I have observed that the hair roots were clearly visible with enlarged pores. I gave her the same medication for 1 month, waited for 1 month. On the seventh follow-up, that is on 25th of August 2023, her hair roots were visible with the enlarged pores. That time also, I have given her the same medication. On 22nd of September, small hairs were visible on the scalp except on the occipital region. Uh, this was due to, I guess, this was due to the friction of when we sleep over the pillow, there is a friction on the occipital region. So that's why I have concluded that there is not a improvement. But on the overall scalp, small hairs were visible. That time also I have given her Staphylococcus aureus. On the 10th follow-up, that is on 30th October 2023, new hair growth was there. That time I was feeling very happy, and at that time also I didn't change the medication. I have given the same medication for 4 weeks. In follow-up, on 11th follow-up, 11th of December 2023, new hair growth was seen on even on occipital region. That time I have given the same medication. Throughout the journey of patient, I never changed the medication. Staphylococcus aureus single dose I am giving to the patient. On the 12th follow-up, on 8th of January, length of hairs was increased and the pores were uh, having enlargement, and good hair growth was visible that time. I repeated the medication, and on the 13th follow, that is on 12th of February 2024, existing hair length was increased, and all the hair problem was improving that time. So I gave her for medication for 4 weeks, that is 1 month. But in this follow, patient reported that she's shifting to abroad with her son, and it is permanently, and she was shifting permanently, so that she don't have to face the society in which she is living now. Now, this this is the turning point of this case for me. Here is so there are some pictures which I have. Uh, so you can able to see the first picture on the left side on the 29th of February, 29th of the April 2023. That is on the day of case definition. You can able to see that the scalp of the patient is very clean, complete baldness. No any skin, no any hair present on the scalp. On the fifth follow-up, that is the right picture, you can able to see the pores which are enlarged on the fifth follow-up. And you can observe the small hair root follicle opening and some hairs also. On 30th, 30th October 2023, on the 10th follow-up, you can able to see hairs on her scalp. Here, on the 12th of February 2024, on the last follow-up, you can able to see the hair growth. It is a quite good hair growth. This is the picture, and the patient is having the age of 57 years. So the patient's hair were white in color. So I think it is very unclear in picture. But as a physician, I could see the good effects on hair growth that time. So this is the last follow-up of the patient where she told me that she is leaving the country with her son so that she can live there frankly. So what is my learning from this particular case? This case was it was for about 1 year uh, with me. So there are 5 learnings from this case. The first learning is emotional factor as a maintaining cause. This patient's deep sense of humiliation and dishonor continues to affect her emotional well-being despite of the action of the remedy. This unresolved emotional conflict may prolong or hinder complete recovery. Even the physical symptoms like hair growth begin to improve. The emotional stagnation, which act as a barrier to the holistic healing and must be addressed alongside with the remedy. My second learning was the importance of addressing maintaining cause. The homeopathic treatment alone cannot fully resolve the case where emotional and social issues are unresolved. The third learning was the holistic management of the particular case. Although the well-suited homeopathic remedy initiate the process of hair regrowth, true healing require addressing the patient's emotional wounds. Without resolving those emotional wounds, that is the humiliation and strained family dynamic, the patient may remain emotionally unwell, which risks the reoccurrence or incomplete recovery. The fourth learning is individual responsibility in healing. The case emphasizes that the patient's role in their recovery is very important. Encouraging the patient to confront and process her feelings, such as humiliation and resentment, is critical. Avoidance or suppression of those emotions may lead to chronic emotional and physical health issues. And very important, that is the importance of biopsychosocial model in homeopathy. Understanding this case using the biopsychosocial model emphasized that the patient's condition is not purely physical, but it is intricately linked to her mental and social experiences. Addressing those psychological and social aspects alongside the physical symptom, it is crucial for achieving complete and sustained healing. In this case, you see the patient deep sense of humiliation and dishonor, which is existing and maintaining cause, which remains unresolved and expressed on her hair, and it causes complete baldness over the period of time. This is the classical psychosomatic case where mental troubles expressed on this somatic tissues, and after staphysagria, symptom goes in a reverse order. That is, patient's hair start coming, but her humiliation remained unresolved, and it act as a maintaining cause in this case and obstruct the complete cure. This can be better understood through the biopsychosocial model, which I have explained earlier. So this is the biopsychosocial model of the presenting case. Here, biological aspect were alopecia totalis. Psychological aspect is the persistent feeling of humiliation and suppressed anger, which act as a psychological obstacle to complete the recovery. And social isolation due to the fear of perpetuates the emotional distress. Now, the point is, what are my key takeaways from both these cases? First key takeaway is emotional factor as a maintaining cause. Both the cases emphasize that unresolved emotional conflicts such as humiliation, disappointment act as a maintaining cause, which can prolong the mental distress, hinders the complete cure. Even after the administration of a well-selected homeopathic remedies like staphysagria and natramur, the patient's emotional struggle, such as feeling of dishonor, fear of abandonment, and become barrier to the complete cure. The holistic case management, that is the most important key takeaway, that the true healing require addressing all the dimensions, that is physical dimension, psychological dimension, and social dimension. While remedies may resolve physical symptom like alopecia or dermatitis, the unresolved psychological wound can lead to the incomplete recovery or reoccurrence. Now, what is the learning specific to the each case? First case was of dermatitis and second was of alopecia totalis. So in case number 1, chronic disappointment and anger from marital discord exacerbate skin symptoms. Despite improvement in the physical complaints with natrum muriaticum, emotional healing remain incomplete due to the unresolved resentment. While in case 2, that is alopecia totalis, the deep humiliation linked with the daughter's love marriage and societal judgment triggers the alopecia of that particular patient. Staphysagria initiates the hair regrowth, but the persistent feeling of dishonor require holistic psychological intervention. Then what is the limitation of homeopathy alone? Both the cases demonstrate that homeopathy, while effective in addressing physical symptoms and initiating emotional healing, it requires complementary support such as counseling and family therapy to fully resolve the psychosocial conflicts. The role of biopsychosocial model in homeopathy. So this is the core aspect of my presentation. So these both the cases highlight the importance of integrating the biopsychosocial model for a comprehensive understanding of the patient's condition. Biological condition like alopecia totalis and dermatitis. Psychological correlation with persistent feeling of humiliation, anger, insecurity, and anxiety. Social aspect is like strained family dynamics, societal expectations, and isolation. Now, what is the individual responsibility in healing? Patient has to be responsible enough for the healing of her complaints. So, encouraging patients to confront and process unresolved emotion such as humiliation and resentment is very crucial for long-term recovery. Without that, the complete healing cannot be happen. Avoidance or suppressions of emotion can perpetuate the chronic issues. So this is the crux which I have accumulated from both of the cases. Overall, I'm trying to correlate these things with the WHO's definition of health. That is, health is defined as the complete state of physical, mental, and social well-being of an individual and not merely absence of the disease or infirmity. So basically, the biopsychosocial model is very important aspect in homeopathy while case taking to resolve the unsolved problems of the patient. So I think this is all from my side. If there is any question, then you can ask me. And if there are any suggestions also, then I would like to
Okay.
welcome those suggestions.
Thank you, Dr. Sneha Kharatkar. It's really a very good session, and you have proved that the role of biopsychosocial model is something great for homeopathy. Actually, each and every case in the homeopathy need to be treated in the way you have shown in this presentation. And whatever be the condition, whatever be the disease, it doesn't matter with a homeopathic doctor. You just try to enter into the patient, then only you will be able to find the cause behind the illness. And if you are able to trace the cause behind the illness, definitely we will have the remedies with us. But if finding out such a remedy is a thing, then requires the lifestyle of the patient, life cycle of the patient. If the patient interaction with others, and what are the surroundings around the patient. All these things need to be looked into while treating such cases. Frankly, people may come with a hair fall, simply a simple hair fall. Then we may think that the doctor, I want medicine for this hair fall. But when we trace the cause behind the illness, we may find that there are there are a lot of things that were suppressed in the mind of the patient. Even in school children, as the students, even in just married wise, and whatever be, you can find such situations. Even in people, gents, sometimes there may be loss of money, or sometimes they may be loss of position. All those things may lead to this kind of thing. But the interaction the that the time you spend with the patient to find the reason behind the illness definitely will lead to the right remedy. And when you select the right remedy, that will totally cure the patient. I have a little dispute with you on that last sentence, because you told me that in all cases, you need the limit. You have shown that there are some limitations in those cases, but frankly, it is not. Only very few cases required the counseling from the doctor's side. Actually, when you take a case in detail, then only the patient may get the full satisfaction, and as a result, they may be half cured in that way itself. Then there may not be further the medicine, homeopathic medicine are the super counselors, I must say. They will give whatever counseling the patient require, and there is no need of the secondary support. But in some cases you need only some cases you need counseling also. Only those people who are really willing to take counseling really accept the counseling. All there are people who don't like to have counseling. They won't agree. Then they may run away from your clinic. Oh, this doctor started counseling me. What is the purpose of? I know what is my problem. I know I have several people told me that you are doing this thing, that may be wrong, but I know what I have to do. So that kind of stubborn persons are there in the society. So better not to counseling in all cases. The homeopathic medicine are supposed to be a super counsel. I have written an article on that by the heading that homeopathic medicines are super counselors with a case demonstration. Okay, thank you. Anyway, congratulations. We can talk in the later part. Some people are interested in discussion. Dr. Indrani has raised his hand, so you can talk, Dr. Indrani Bhavatkar.
Thank you, sir.
Please. Okay.
Can you hear me, madam?
Yes.
Okay. Thank you, sir, for allowing me. Madam, I'm practicing in Maharashtra, Pune area. In nowadays, like from 2-3 days, there is a news shown on the TV that in Buldana district, around 150 people are becoming bald. Their hairs are just catched, pulled, and they all become
Yes.
bald. So, can you suggest your approach for such cases? Because the entire village is disturbed with it. Now, the AIMS team has come to find out the cause of it. They just pull. If you want, I can have a 1-minute video shared also. It is
Yes.
shown on TV, or if you are knowing the news, it is okay, no problem. So, can you suggest any approach from your side? Can you hear me, madam?
Please
Sir,
repeat the question.
regarding the situation of the complete baldness, which you have told us.
Ah.
Yes, sir. Yes, sir. Sir, I think, sir, there is a problem where we have to find out the root cause of that particular situation, epidemic, which we can say for that matter.
Okay.
I think in Buldana district, there is a problem in water, sir. So that is the maintaining factor as well as the exciting factor cause
Yeah.
for the state of complete baldness in those person. I have seen those news,
Okay.
and the research team is
Working on it.
very
Yeah.
well
Yeah.
working on that
Yeah.
issue. But yes, sir.
Actually,
Yes,
madam,
sir.
they showed
But
that.
I think there
Uh-huh.
is a yes, sir.
Can you hear me, madam?
Sorry.
Can you hear me, doctor?
I think I have interrupted you.
Okay, okay. Actually, they are showing that the TDS
Hello.
level of water is 150, which is supposed to
Yes,
be
sir.
5 to 6. But like from a homeopathic point of view, that we can say it can be a trigger factor. I saw it in complete repertory. The drug like alumina, it is showing me. That means the rubric was a hair pulled out hair. Then alumina, China, MacCaps. Should we use this in such cases? That is my question. Hair fall out when pulled.
Yes, sir. You can take it as a research. Yes.
Uh,
Definitely, sir. You can use such medication as a research part. You can
Such part. Okay,
you
okay,
can
okay.
definitely use those medication, but sir, we need to understand what is the pathophysiology of that area, that water which the patients are using, because it
Okay.
is not a factor which is internal in nature. This is a
Yeah, yeah.
factor that is external. Everyone is
Okay.
not getting that complete baldness,
Yeah,
because such
entire village
patients,
is suffering.
those
Village is
have the
suffering
high.
actually.
Okay, then sir, definitely there must be any problem with water, sir.
Okay.
Without that matlab water problem, without any infection, even infection also, without any infection or without any exciting cause, there will not be any problem, sir. And if the entire village is suffering, then there must be a underlying cause, and we have to find it out, sir.
Okay. Actually, I'll just suggest you. From my side, I thought that we should collect the physical journals of every patient and just consider them as a
Yes.
dominating myasm as syphilis for these cases and give medicine. So, would you suggest any correction in this?
uh, No, sir, it is actually correct, but I would like to focus on the grassroots level. That is why it is happening in that particular village only. That is my question.
It is in
So
all
we
age
have to
groups,
look
like from
after
child to
that.
old, in old age. Actually, it's a new news, so I just wanted to have your view because AIMS is also researching
Yes,
on
sir.
it.
I have also. Yes, sir. I have also read that news, and
Oh,
everything that public health professionals are working on that particular aspect, and public health lab also is working on that particular area, sir, for
okay,
water
okay,
testing.
okay, no
okay.
problem. Thanks for the interaction. Yeah, yeah. Sir, you may
Okay,
continue.
thank you so much, sir. Thank you so much.
A very excellent question and very good answer. And now it's up to Dr. Vipachivasnik to add something more to this session. You can ask your question also, Dr. Vipach.
Uh, Good evening, sir. Sir, actually, I would like to answer the participant who asked initially about the Buldhana district. Uh, that is, sir, very well. Sir is very well addressed that situation that people have baldness over a specific geographical area, and he also told that the TDS level of the water is more than the acceptable level. So we need to understand, we need to find out the other causes apart from the TDS level, like the radioactivity. Like the people are not exposed to that water now. They are drinking that water in, from over their lifetime. But suddenly now they have developed baldness. So we need to find out the pollutant or any other factory which is around their locality, and might be that factory or might be any radioactive element is mixed up in their drinking water, and that may cause the baldness. So we need to find out the exact cause in a given water, and if uh, we have find it, something is wrong with the water, then we need to treat that accordingly. So that's my response to the question what the previous participant asked.
Yes. Dr. Harinath, you want to speak something? You have made some comments here. If yes, please unmute yourself and speak.
Yeah, usually in the rural background, the people's mindset will be almost similar. And then could it not be some other social issue which has made most of them to react in a certain psychodynamic manner? And that has led to this baldness. Why not look at from that angle?
Okay. Anything more?
That's all.
Something happened. That's all. And Dr. Sneha, if you want to say anything, want to add anything more? Yes, Dr. Ramprasad, sir, you can speak.
Thank you, Dr. Ganesh ji, and Namaskar everyone. Dr. P.Shala, congratulations, Dr. Sneha Madam. Very good presentation. Holistic biopsychosocial model. Homeopathic science is a biosocial, psychosocial model. Homeopathy is a very good science and main cause of emotional. Treat the patient, not the disease. Emotional is the main factor. Anger, grief, etc. The main cause of disease, emotional, invisible. And treat the homeopathic medicine is invisible. So homeopathic is the biopsychosocial treatment. Very good science. Very, very thanks, Madam Sneha. Thank you.
Thank you, sir.
And now I invite Dr.
Thank you
Hariharan
so
sir
much, sir.
to say a few things, as well as you can say what of thanks to the session, sir. Hariharan sir, please unmute. Okay. If anyone want to say a few things, you can raise your hand, or we can directly go for closing session. Yes, anyway, it's a very good evening to share such a wonderful knowledge, and we had a very good discussion on the reasons behind the hair fall in a particular area. And we need to study in all the aspects of the reasons behind the problem. And of course, we need to study the water, whether there is any radioactive element in this water, whether it is too hot or too hard, or something like that. Anyway, even in that's why just like different studies need to be adopted in different situations. But when a patient comes to a clinic, that's a different situation. He alone, sometimes the only person in the family, whether it is a child or a mother or the husband or father, may be affected. But in a particular area, it means something is entirely different. So we need such studies in the future also. Anyway, now it's the time to wind up the session. I invite Dr. Indrani Bharat to say what of thanks to the session, Doctor.
Okay, thank you, madam. Thank you, Madam SNEHA KHARALKAR. And basically, the presentation was very lucid, informative, and your entry in the case was quite nice after repetization. So we all appreciate from IFPH. So I would like to thank you on behalf of IFPH and hand over the mic to Dr. Danesh.
Yes, Dr. Sneha, you want to say anything more?
Thank you so much, sir. Sir, I lastly want to thank you for providing me such a beautiful form to share presentation, sir. Thank you so much. And thanks a lot to Dr. N.K. Sahni, sir, for initiating this forum for promoting homeopathy. Sir, this is a very good initiative, I must say. And lastly, I would like to thank my principal, Dr. K.Z. Patil, sir, uh, for his constant support. Thank you so much, sir.
Thank you, Dr. SNEHA KHARALKAR, and those who attend the session. Tomorrow, we will have a session from Dr. Rohit Sharma, and he will be talking about utility of homeopathic repertory in fetal well-being. That's another big subject coming tomorrow. All of you can join the session by using the same link that you joined today. Thank you all. Good night. It's over to Dr.
Thank you, sir.
Ph.DScholar
Thank you.
to moderate the Malayalam session. Please unmute, Doctor.
Thank you.